So you've got shoulder pain, and you've probably tried a lot of things. Maybe you've had it a long time. Maybe you've had it a short period of time. Either way, it's really making life challenging. So I'm going to be sharing a series of Friday value videos on the shoulder, and hopefully it's going to benefit you a lot. And I'm going to start off with just a few basic things for this particular session. So there's common diagnoses for shoulder pain, right? There's rotator cuff tear, there's partial or complete. So it really matters which one it is. There's something called an impingement syndrome, there's bursitis, there's osteoarthritis, and then there's plain old shoulder pain. People come into the clinic and that's their diagnosis, shoulder pain, right? With no other mention of anything. And then these are common treatments for shoulder pain: corticosteroid injections, medications, anti-inflammatories, and pain meds, right? And then full-blown surgery, a debridement, rotator cuff repair, even a total shoulder replacement. And then there's what I call conventional PT, which means you're going to get a lot of modalities: hot packs, cold packs, ultrasound, e-stim, whatever is the modality of the day, and your basic conventional shoulder therapeutic exercise, something that's printed off a computer and handed to pretty much everybody who comes into the clinic with shoulder issues. That is cookie cutter. That is not what you want. So when it comes to treatments, the most important question to ask when you're advised to begin a med or have a test taken or undergo a procedure is, how effective is it at fixing my problem, and what are the risks? That's huge, right? So let's look at the flip side of the coin. What's actually causing shoulder pain? Well, yeah, chronic inflammation can cause it. Impaired circulation can cause it. I'm going to cover the last two right now in this one: weakness in major muscle groups and impaired mobility in major muscle groups. And you might be like, well, isn't it my shoulder? Guess what? A lot of the times it's not your shoulder. Lack of physical exercise. Now, I just listed a few things here. The glutes, right? Maximus, gluteus maximus. Max is power. That's your power source. If you're sitting on it for decades, guess what? Max gets weak. He gets smaller, and you get what's called a pancake butt. It's flat. So you've been sitting on your backside for decades for your job or your profession, and Max is weak. He's not working. Guess what? That can impact your shoulders. Your abdominals. Yeah, your abdominal can impact your shoulders. Your rectus spinae, that's lower back muscles. Your hip flexors. When you're sitting, those hip flexors shorten and they don't work right when you go to stand up, and it pulls everything wacko. So your glutes, your core, your hips all impact your shoulder function, even your ankles. Yeah, I'm going to be talking about that in a very near video. So here's the last thought that I want for you to have at the end of this brief Friday value video. Understanding authentic human movement leads to better training choices with improved results. So what does that mean? Authentic human movement, better training choices, improved results. Who doesn't want that? Guess what? A lot of people are doing what would be called inauthentic physical exercise. He's isolating his bicep. He's got perfect form, but isolating a muscle can lead to problems. And I'm going to get into that in future videos. So I hope you enjoyed this, and I will see you next week.